According to the government of Somalia and its international partners, including UNICEF and WHO, nearly half of 71,000 people who may have died due to drought and famine between January 2022 and June 2024 are children under 5 years old. The study, jointly conducted with the London School of Hygiene and Somali-based CGTN University, reveals that millions of internally displaced children remain vulnerable to climate change-related shocks.
41% out of the excess mortality, 71,000, are children under 5. This is really very, very sad. And I have personally been to met communities in Baidawa, in Dolo, who told me the mothers, as they left, their rural areas, their villages to seek support, they had to bury sometimes 2 children on the way. This is really very, very sad. It is also the reminder of the impact of the climate change on Somalia, on Somali people who have the least to contribute to that. So this is very painful. We have to put the human face and the human cost.
Somalia lacks accurate data collection mechanisms due to its weak public institutions. The bodies are still struggling to recover from decades of conflict in the country, leading to delayed responses to crises such as conflict, drought, and flooding. Authorities hope that increased coordination with UN agencies like UNICEF on data harmonization can improve effective policy formulation for planning and response purposes.
But as a government, we are committed to involve all partners, whether they are donors, whether multilateral or bilateral, engagements, to make sure that we involve everybody to collaborate and making sure that we reduce the mortality rates in Somalia. At the health sector, we are trying to use our DHSI2, which is going to be where all the data is going to be saved for the health sector. And of course, there's a national data center for the country, which has been already established. And I think there is also, the act has already passed in the parliament, and we are really working on to make sure that we have harmonized data protection, safety, and also, analysis, and also to inform the decision makers.
Experts say Somali education institutions, particularly universities, can play a key role in building strong state institutions by producing competent professionals. This will help the country less reliant on foreign experts whose work is limited by security situation in parts of the country.
In general, academic institutions in Somalia have been dealing mostly in education, but nowadays we have to upscale, and CGTN Universities is doing its best to train our expertise to provide them with the proper training that they need for us to lead in data, and also and have the expertise to produce an appropriate experience. Because if you look in the current situation, many of the time Somalia goes out to get such expertise. So for the academics, they need really to do their best.
Meanwhile, humanitarian agencies are appealing for more funding to assist needy communities in the Horn of African nation, including vulnerable children. Mohamed Kahi, CGTN, Mogadishu, Somalia.